Have you ever looked at your goat and thought, something's off, but I just can't tell what? You're not alone. Missing the early signs of illness is one of the most common and costly mistakes in goat farming. But what if you could spot those signs early and prevent the most dangerous goat diseases before they even start? In this video, we're diving into the real world of goat healthcare. From silent killers to daily habits, here's everything you need to know to keep your herd healthy, productive, and thriving. It all begins with you. Raising healthy goats isn't just about feed and fencing. It starts with being an observant, informed caretaker. One of the smartest things you can do is find a veterinarian who actually specializes in goats. Ask them how many goats they've treated and how recently. Not all vets are created equal when it comes to small ruminants. But even with a great vet, you still need to be your goat's first line of defense. Watch their behavior, posture, appetite, and eyes. Subtle changes like isolation, limping, or a sudden loss of appetite can mean big trouble if ignored. Let's now look at the major health problems you'll encounter as a goat farmer. First up is CAE, caprine arthritis encephalitis. It's a viral disease that causes joint pain, pneumonia, mastitis, and even brain issues. There's no cure, and it spreads silently through milk or close contact. Your best defense is regular testing and a closed herd policy. Then there's CL, caseous lymphadenitis. It shows up as large, ugly abscesses in the lymph nodes. It's highly contagious and hard to eliminate once it spreads. Infected goats should be isolated, and in severe cases, culling may be the only way to protect the rest of your herd. Another silent killer is John's disease. It causes chronic diarrhea and dramatic weight loss. By the time symptoms appear, it's often too late. It spreads through fecal contamination or milk, and again, no cure exists. Only buy from tested, clean herds and isolate any new arrivals. Then we have coccidiosis, a serious risk for young kids. It causes watery or bloody diarrhea, lethargy, and in some cases, death within days. Treat quickly with anticoccidial medications like Corid, and consider medicated feed during stressful periods like weaning. Toxoplasmosis is another disease often overlooked. It's spread through cat feces and causes miscarriages in pregnant does. If you have cats around, keep them away from feed and kidding areas. Next is urinary calculi, a common issue in male goats. It's like kidney stones, but much more dangerous. You can prevent it with a proper calcium to phosphorus ratio in the diet, around 2.5 to 1. It's an utter infection that causes pain, milk loss, and long-term damage. Foot rot is another problem that creeps up quietly. It's caused by bacteria and fungi in wet or dirty environments and leads to limping, swelling, and foul-smelling hooves. Regular hoof trimming, foot soaks, and keeping pens dry are the keys to prevention. Don't forget about parasites. Internal parasites like barber pole worms drain your goats of blood, causing anemia and even death. External parasites, lice, mites, ticks, can be controlled with repeat insecticide treatments and good hygiene. A healthy coat, strong hooves, and good appetite often begin with correct mineral balance. Daily goat care matters more than anything. You should be doing health checks every single day. Look for signs of discomfort, changes in stool, body posture, or appetite. Know your goat's normal temperature, between 101.5 to 100. Keep solid records, vaccination dates, illnesses, treatments, fecal egg counts. Use notebooks, apps, or wall charts, but always track what's going on. Build your own goat first aid kit. These small items can save lives when time is critical. Clean, dry shelters and smart pen designs go a long way in disease prevention. Always quarantine new goats for at least 30 days. Trim hooves every 4 to 6 weeks, and choose whether or not to disbud, dehorn, based on your herd's safety needs.